These mini grants are delivered by Penn State Hershey Pro Wellness Center. Funding is provided by the Pennsylvania Department of Health through the Preventative Health and Health Services Block Grant from the Centers for Disease Control and Prevention. Congratulations, Capacity Building for Physical Activity mini grant recipients, and welcome to your introductory webinar. This introductory webinar is intended to give you an overview of what is required of your school or community-based organization, the timeline for completion, and an introduction to the tools to be used in completing these requirements. My name is Alicia Schuick, and I am the School Outreach Specialist for the mini grant collaboration between the Penn State Hershey Pro Wellness Center and the Pennsylvania Department of Health. You may notice a new logo and web page at the bottom of our slides. I'm happy to announce that effective April 1st, the Center for Nutrition and Activity Promotion was renamed Penn State Hershey Pro Wellness Center. Any future communications will reflect our new name. If you have questions about the material covered in this webinar, you can contact me at grantmanager@phs.psu.edu or at 717-531-1440 extension 7. I recommend using the Grant Manager email alias for questions and all grant correspondence, as those emails are delivered to all of our mini grants team members to ensure you will receive the quickest response possible from our team. This includes me, our school outreach specialist, Joanne Jones, our administrative coordinator, and Gail Snyder, our project coordinator. At the end of the webinar, you should be able to understand your responsibilities as a grant recipient and the timeline in which to complete those responsibilities. Identify the benefits of using the School Health Index within your school, and assess the health of your school by using the School Health Index. If you have not yet returned your signed Conditions of Award agreement, please return that as soon as possible. In addition to your Conditions of Award, you should also provide a signed letter of agreement from your community-based organization if you're a school, or your school partner if you're a community-based organization. This letter should include the agreed upon details of your partnership, and if possible, a shared facility use agreement. We encourage schools to complete the School Health Index in its entirety, as it's very useful when developing a plan for sustainability. However, for the April deadline, we're requiring you to complete and report on modules 1, 3, and 4. These 3 sections are the sections we feel are important in providing a well-rounded look at the physical activity and nutrition components of a school. You should develop and submit your action plan based on your School Health Index and approved project by May 31st. You should submit an invoice for reimbursement in May 2013 for all expenses that you've incurred up to that point. You should complete the webinar satisfaction survey by the end of May. The approved program should be implemented in the 2013-2014 school year. You'll then complete and report on modules 1, 3, and 4 of the School Health Index by the end of May 2014, and submit an invoice for reimbursement in May 2014 for the remaining balance of your total awarded amount. Please note that requests for reimbursement received after June 30th, 2014 cannot be reimbursed. Complete the overall experience survey in May 2014. More details will be shared about both survey evaluations at a later time. There are 2 slides included in your packet that explain the details of this timeline. There are a number of tools created by the Pro Wellness Center that will guide you through your responsibilities as a grant recipient. A frequently asked questions page, along with links to the tools and websites you'll see in this webinar series, can be found on the Pro Wellness Center website, www.pennstatehershey.org/prowellness/grants. The website will be continuously updated and is a great place to start when looking for information about your grant requirements or other resources. The School Health Index website, www.cdc.gov/healthyyouth/SHI, contains more information about the School Health Index, including a link to the online system that you'll use for entering your school's data and generating reports. The School Health Index is a self-assessment and planning guide that will allow your school to identify strengths and weaknesses of school health policies and programs and of community-based organization partnerships. It was developed by the Centers for Disease Control and Prevention in partnership with school administrators and staff, school health experts, parents, and national non-governmental health and education agencies. The questions in the School Health Index are derived from CDC's research-based guidelines and strategies for school health programs, which identify the policies and practices most likely to be effective in improving healthy behaviors among students. It was recently updated and is now in its 5th edition, which was released in 2012. The School Health Index is structured around the CDC's coordinated school health approach. There are 8 modules in the School Health Index which correspond to the 8 components of the CSH approach. The coordinated school health model highlights the importance of involving and coordinating the efforts of all 8 interactive components to maintain the well-being of young people. The 8 components are physical education and other physical activity programs, health services, nutrition services, counseling, psychological and social services, healthy school environment, health promotion for staff, family and community involvement, and health education. Using the School Health Index to promote healthy behaviors and create a healthy environment in schools can increase students' capacity to learn, reduce absences, and improve physical and mental alertness. In addition, using the School Health Index to identify areas of strengths and weakness increases long-term policy improvement, increasing sustainability in the programs you've proposed to implement. Something else to keep in mind as you begin working with the School Health Index to develop your individual program or policy goals are the overall program goals of our center and our collaborators, the Pennsylvania Department of Health. We would like to see all grant recipients develop action plans utilizing evidence-based strategies, including joint use agreements and active schoolyards, to serve as a foundation for future programs. Schools and their community-based partners will complete the School Health Index on 2 occasions to measure change as a result of evidence-based strategies. We'd like to see greater than half of recipients have a sustainable joint use agreement or active schoolyard agreement. And we, as mini-grant staff, aim to provide exceptional technical assistance to award recipients. We will use the data in your reports and the 2 evaluations to measure our success with these goals. As mentioned before, we strongly encourage schools to complete the School Health Index in its entirety. Taking a close look at all 8 areas of school health is very useful when you're developing your plan for sustainability and implementing policy change. As grant recipients, you're required to complete 2 phases of the School Health Index. The first is to complete the discussion and planning questions for modules 1, 3, and 4 of the School Health Index. You will complete this in April 2013 and then again in May 2014. Phase 2 involves the development of your action plan. You'll see the phrase Plan for Improvement used in the School Health Index. That term is used interchangeably with Action Plan. We offer assistance to all mini-grant awardees in developing their action plan or plan for improvement. If you would like assistance with this step, you can schedule a call with me, the school outreach specialist. I'd be happy to share resources related to your specific project during that call. Before you begin working with the School Health Index, you should consider who will work together to complete the questions. The SHI module questions are designed to be answered in a collaborative fashion with members of your team who are most knowledgeable about that area of your school's policy. This slide provides examples of people who you may want to include in your SHI team. From the school, you may want to include administrators, students, teachers, and representatives from your food or health services departments. From the community, you may want to include parents, businesses, healthcare facilities, or youth-serving organizations. The SHI is available in 2 versions, one for elementary school and one for middle or high school. The majority of items in the 2 versions are identical. However, some questions are targeted towards school level. For example, the Elementary School Health Index includes questions about recess, where the middle and high school SHI asks about tobacco cessation services. You should select the version that captures the largest part of your population. For example, if your program is designed for grades 3 through 6, but 6th is the only grade in the middle school, you should choose the elementary school version. In addition, the School Health Index is available in both a paper and online format. We ask that schools utilize the online version for a few reasons. First, you can customize your School Health Index based on the health topics you'd like to address. Second, your scores calculate automatically. And third, you can archive previous versions of the School Health Index, which will assist in record keeping when you complete the SHI in the next school year. Sections of the paper format may be helpful when reviewing the modules and for distributing questions between group members. You will then use the online system to enter your data. The paper versions and the online system can be found at www.cdc.gov/healthyyouth/SHI or through links on our Pro Wellness Center website. As mentioned, more information about the School Health Index, including the PDF versions of the SHI and the link to the online system, copies of this presentation, and instructional webinars for navigating the online School Health Index system are available on our pennstatehershey.org/pro-wellness/grants website. If you have questions about your responsibilities as a grant recipient, please call or email me, Alicia.